Some tumors can grow their own teeth, eyes, and hairs. These tumors are known as teratoma, and they are derived from germ cells that can develop into any type of body tissue. As a result, these tumors can contain a variety of different tissue types, including hair, muscle, bone, and even teeth and eyes. Teeth found in teratomas can be fully formed, resembling normal teeth in structure, though they are often malformed. The eye tissue found in some teratomas can include some deformed basic structures like retina, iris, or cornea, though these are typically not functional. The occurrence of such complex structures within a tumor reflects the extraordinary potential of germ cells. In normal embryonic development, these cells differentiate into various specialized cells that make up the human body. However, in teratomas, this differentiation process becomes disordered, leading to the formation of various tissue types in a single tumor. The presence of teeth and eye tissue can present challenges in terms of treatment and management of these tumors. Teratomas can be benign or malignant and may occur in various parts of the body, including the ovaries, testes, and rarely other areas like the brain. Their treatment depends on the location, size, and stage of the tumor and may involve surgical removal and, in some cases, chemotherapy or radiation therapy. There are two types of teratomas: mature teratomas, which are generally benign and most common during reproductive years, and immature teratoma, which are cancerous and predominantly found in children.
An organ believed to be useless by doctors might actually fight cancer. The thymus gland, which is a small fatty organ behind the sternum, is often removed by doctors due to the assumption of its useless in adult life. However, a recent study found that adults who had their thymus removed faced an increased risk of death from various causes and were more likely to develop cancer. While the study's observational nature doesn't confirm the thymus removal as the direct cause of these risks, it raises concerns about the gland's importance. In children, the thymus is essential for immune system development, particularly in generating T cells which fight germs and disease. Children who had their thymus removed show weaker responses to vaccines. Although the thymus reduces its T cell production and shrinks by puberty, its removal during cardiothoracic surgery for conditions like heart disease or thymus cancer was previously considered harmless. According to the study, patients who had their thymus removed were nearly twice as likely to die within 5 years and had a doubled risk of developing cancer, often more aggressive and recurring compared to those who retained their thymus. The exact reasons for these associations are unclear, but researchers speculate that thymus removal disrupts the adult immune system's functioning. Patients who had their thymus gland removed also showed less diverse T cell receptors, potentially contributing to cancer or autoimmune diseases post-surgery. The study challenges the notion that the thymus gland isn't necessary for long-term health.
Colon cancer is affecting more younger men and women than ever before. A recent report reveals a rise in colorectal cancer among younger adults, particularly those in their 30s and 40s. Previously, the disease mostly affected the elderly. However, it has recently emerged as the deadliest cancer for men under 50 and the second deadliest for women in the same age bracket, surpassing previous leading causes. While the percentage of new cancer cases in those 65 and older has slightly decreased, diagnoses in adults aged 50 to 64 have risen. It's still unclear why this is happening, but some researchers attribute it to obesity rates, sedentary lifestyles, and poor diets. Colon or colorectal cancer is a type of cancer that begins in the large intestine, which is the final part of the digestive tract. The disease usually starts as small, non-cancerous clumps of cells known as polyps that form inside the colon. Over time, some of these polyps can transform into colon cancers. Polyps are often small and produce few symptoms, which is why doctors recommend regular screening tests to detect and remove them before they develop into cancer. Many individuals with colon cancer do not experience symptoms in the early stages. When symptoms do occur, they can include a persistent change in bowel habits, such as diarrhea or constipation, a change in stool consistency, rectal bleeding, abdominal discomfort, fatigue, and unexplained weight loss. Early detection and treatment of colorectal cancer can prevent death.